Is it possible that stimulation of the vagus nerve could counter chronic stress and inflammation? Might it help with persistent brain fog, gut issues, anxiety, and even poor sleep? The answer is yes, with a few caveats. And this is an important therapy I think you need to know more about due to how it can regulate inflammation, the immune system, and some key centers in the brain. So today we'll cover why your symptoms might be an indication that the vagus nerve is dysfunctional, and then the 4 key evidence-based methods you can utilize at home so as to improve your vagus nerve and reap all of the associated benefits. Okay, so the context for the vagus nerve occurs within your autonomic nervous system. These are functions that you don't actively think about. You can't consciously control your blood pressure or when you go to the bathroom, things like this. So within that autonomic function, there are 2 arms of this nervous system. You've probably heard of the sympathetic or the fight or flight on the one hand. This gives you energy. And on the other hand, the parasympathetic, this is rest and recover. Probably not surprising that most people tend to be a bit skewed toward the sympathetic, the fight or flight, but this is also where the problem starts from, in that the nervous system should be able to swing like a pendulum from sympathetic when you need to be on, like me right now. I need to be sympathetic, attentive, pulling these different pieces together, having this conversation. But then after I eat lunch, let's say, or dinner, my nervous system should swing back to parasympathetic, or even better yet, when I'm trying to go to sleep. This is something that I think haunts a lot of people in that they don't seem to have that appropriate swing. They might get swung too far sympathetic. They're anxious, they have insomnia, and then they have periods where they're forgetful or they can't sleep. And this is because the autonomic nervous system pendulum is not functioning well between sympathetic fight or flight, parasympathetic rest and recover. And the vagus nerve resides on this side of the autonomic ledger, if you will, on the parasympathetic side. So by fostering better function or tone of the vagus nerve, we have better parasympathetic function. That's your rest, digest, and recover. There's also a key concept here that we should address, which is stress. So work stress, financial stress, relational stress triggers you to be sympathetic, but also, key point, inflammation triggers the sympathetic nervous system. So if you've had joint pain or abdominal bloating or discomfort, any type of inflammation, swelling in your fingers, this inflammation all skews you sympathetic. And what ends up happening is the more sympathetic you are, the more sympathetic you become. So this cascades where you're more sympathetic, you're more stressed, you're more sensitive to stress, you're also more inflamed and more sensitive to inflammation, and it leads to this self-feeding cycle, which can be interrupted, and that's what we're going to discuss in the body of the protocol. But this stress inflammatory cycle is a key point, I think, and an overlooked component of a lot of dysfunction and symptoms modern day. Take this one case in point from a 2023 review paper. Inflammation activates the sympathetic nervous system, the SNS. And when inflammation becomes chronic, the sympathetic nervous system is persistently elevated. So inflammation triggers you to become sympathetic. Here's the other side of that cycle. 2021 clinical trial. In individuals who were under high amounts of stress, they actually had more inflammation in their blood as compared to people with normal levels of stress. And that's what you're seeing here. LPS, lipopolysaccharide, is one of the particles that will leak through the gut. Some leakage is normal. Okay, so we're all going to have some degree of LPS or bacterial wall membrane fragments leaking through. But here's the problematic part. People who are stressed have an exacerbated response to these particles. So if you're someone who feels like you're sensitive to foods, let's say maybe dairy or supplements, this might be why. Now, in this study published in Cell, they looked at 4 different cytokines, 4 different inflammatory markers. And what you see here is the heightened inflammatory response in 3 out of 4 of the cytokines measured in those who are under stress. So the stressed cohort, stressed versus non-stressed or normal, the stressed individuals had a significantly higher level of inflammation when exposed to the same stimuli as the non-stressed individuals. So this is the cycle. Environmental or psychological stress paired with inflammatory stress leads to this chronic runaway, both stress and inflammation, part of the same cycle, again, which can be interrupted. But I wanted to make sure to tie this in because for some people, I think they're looking to resolve this exclusively via, let's say, anti-inflammatory supplements or diet, which is all fine and good, but they might be missing this key part of the parasympathetic nervous system and the vagus nerve therein. If the vagus nerve, brain health, and anti-inflammatory strategies are important to you, please like, comment, and subscribe. This provides our channel very necessary support so it can reach and help more people. Okay, let's briefly recap some of the chief or hallmark signs that you may have this self-eating stress inflammatory cycle present, or said another way, you have a deficiency in vagal nerve tone. Because the vagus nerve, again, is part of this sort of parasympathetic chain that extends from the brain all the way down to the adrenal glands located on top of your kidneys, you can see aberrancies in stress hormone levels, stress response, and in the hypothalamic pituitary axis. Starting in the brain, we'll kind of work our way down. Poor memory. Now, the top of this chain involves 2 key brain centers, the hippocampus and the amygdala. We'll come back to the amygdala in 1 second. The hippocampus is responsible for converting short-term to long-term memory. But if these centers are in overdrive, if they're not balanced, then you actually see memory and cognitive function decrease. In fact, there may even be a measurable decrease in the gray matter in the hippocampus in the brain. So one key or one clue is you have poor memory or concentration. Now, next to the hippocampus, if you will, is the amygdala. And the amygdala functions how you perceive stressors and stimuli in your environment. Let's say two people you know. You may have observed that one person handles stress pretty well, Tom, let's say, but Sam tends to be very sensitive to stress. This could come down to the level of sensitivity or hyperactivity of the amygdala. So if the amygdala is too turned up, what ends up happening is otherwise normal stimuli are perceived as highly stressful. That triggers this whole cascade where, firstly, a occurrence that may not be super stressful by any sort of objective measure could elicit a stress response in that individual. So you can see, and you do see correlations to the amygdala being hyperactive and people having depression and anxiety. But also, because the amygdala cascades to the pituitary, which releases stress hormones like cortisol, epinephrine, and norepinephrine, you might see fatigue and insomnia. And this is because early phase stress response, people feel kind of jacked up. It can feel a little bit good. But when that stress becomes chronic, the pendulum doesn't swing. And so people can have altered function of the release of these stress hormones. So instead of having this, what's known as diurnal release of cortisol, lots of cortisol during the day, less cortisol at night, the rhythm becomes inverted because the brain centers that are governing the release of these hormones is not functioning correctly. That's the amygdala and the hypothalamus. What ends up happening is daytime cortisol is low. People don't have quite the energy, cognition, or performance during the day, and they can't sleep at night because the rhythm inverts high cortisol at night and kind of cruelly low cortisol during the day. So again, this is how we see connections all within the same cascade of amygdala, hypothalamus, stress hormones of low daytime cortisol and fatigue, high nighttime cortisol, and poor sleep. Because the brain is very important for regulation of things like sex drive, you may also see impaired libido or sexual performance. You hear a lot about these PDE5 inhibitors, Cialis and Viagra, which help with blood flow, but not all of libido, erection, what have you, are mediated by blood flow. And this is why you're seeing certain companies add in dopamine agonists along with things like Cialis and Viagra because they're trying to get more central mediation of blood flow and sex drive, libido, and arousal. And also why certain peptides like PT141 are gaining popularity as another way of improving sexual function. As we'll show you in a moment, certain devices that can stimulate this vagus nerve and this parasympathetic chain have been shown to improve sexual arousal. Now, another indicator that imbalances in this vagus nerve and this parasympathetic chain might be present could be either a rapid heart rate or a slow heart rate or potentially low blood pressure or shallow breathing. Again, this is all showing us that the autonomic nervous system that regulates pulse rate and blood pressure isn't functioning correctly. In fact, in a condition known as POTS, when people stand up, they get dizzy because their blood pressure does not increase to allow a combination of blood flow to brain, and they have a racing heart. And again, vagal nerve stimulation techniques that we'll outline in a moment have been shown to ameliorate not only this condition, but some of the underlying inflammation and autoimmunity that causes that condition. Now, it's probably fairly obvious that there's a connection between stress and digestive function, or said another way, the brain and digestive function. So if you're someone who notices you have sensitive digestion, your bowels are irritable as an IBS, you don't do well with, let's say, dairy or carbs, or you're quick to experience reflux, or you have supplement reactivity, or inflammatory bowel disease, or pain, or constipation. There's varying levels of research suggesting imbalances and dysfunction in that parasympathetic chain or the vagus nerve are what, at least in part, underlies these conditions. And we do have, I think most importantly, interventional data showing us that vagal nerve stimulation can help with all of these conditions. And the final warning sign, if you will, would be inflammation. We've already sort of discussed this, but if you have brain fog, autoimmunity, if you have cardiovascular disease or even diabetes, these have all been associated with lack of vagal tone or insufficient activation of this parasympathetic chain or side of the nervous system. Okay, so this then begs the question, can you test this? Kind of. You can indirectly measure the health of that pendulum swing with something known as HRV, or heart rate variability. The Oura Ring tracks this, Whoop tracks this. A number of devices that give you sort of biometric feedback will track HRV. Heart rate variability tells you the variability of your nervous system to swing from sympathetic, high heart rate, to parasympathetic, low heart rate. So if you're noticing that you have low HRV, that tells you that you don't have much amplitude in the swing of the pendulum. There's other loose proxies like a tilt table test perhaps, but these other tests are more to diagnose various clinical manifestations of vagal nerve dysfunction. I think the best general screening proxy would be heart rate variability. It's cheap and it's very easy to do. And you can also have day-over-day feedback with a wearable device that can allow you to track your HRV changes over time, hopefully showing improved HRV. Again, which is why I'm excited about some of these therapeutics that we're going to dig into, because many of them have been documented to improve HRV. Okay, so then what do we do to stimulate the vagus nerve and sort of this parasympathetic chain or side of the nervous system? 4 interventions I think are the most effective, and we'll detail these in a moment. Here they are though first. 1, reduce stressors and implement supportive lifestyle strategies. 2, utilize one of these vagal nerve stimulating devices. 3, nutritional supplementation. And 4, probiotics to repair the gut-brain axis. So let's go into number 1, reducing triggers and some of these lifestyle supports. One ubiquitous trigger is constant stimulation. Devices like cell phones, computers, tablets secrete blue light that interferes with this day-night rhythm we talked about regarding cortisol, and that should correlate with the cortisol being low at night and also melatonin being high. The blue light and stimulation at night reduce melatonin, therefore thwart sleep, therefore are stressful. Also, you've probably heard this, but there's a direct correlation between degree of social media and smartphone use and depression and anxiety. So reducing as much as you can here would be helpful. Your sleep hygiene. There's 3 components to healthy sleep. Consistency, going to bed and waking up roughly at the same time every day. Duration, how long you sleep. Minimum 7 hours. Ideally, 7 to 9 hours is the sweet spot. Less or more consistently is a problem. And then thirdly, intensity. How soundly do you sleep? Are you waking up 3, 4, 5, 6 times a night? That would indicate low or poor sleep intensity. Also, work stress, financial stress, relational stress. I understand that these are more or less modifiable in different situations, but I would say just do the best that you can. And then finally, there are dietary triggers or stressors. Caffeine. Now, I'm not saying that you should get your caffeine consumption down to 0, because there is clear, and we'll link to the review we did on benefits of caffeine and coffee, because I think that's worth double clicking if this interests you. I think it'd be incorrect to say that, oh, everyone's stressed, so therefore no coffee, no caffeine, because there are clearly neuroprotective, so brain protective benefits and other benefits secondary to the polyphenols in coffee, plus or minus caffeine, and from caffeine in and of itself. 200 to 400 milligrams per day seems to be the sweet spot. So if you're consistently going over 400, this is where there's probably, or there's more likely to be problems. So reasonable, moderate, 1, 2, 3, either cups of coffee or shots of espresso per day, that is a reasonable intake. But many of you have probably noticed if you drink too much caffeine, you have anxiousness, poor sleep, what have you. And this is due to overstimulating that pendulum to that sympathetic side. Alcohol. I would be as prudent with alcohol consumption as you can. And also ultra-processed food, probably not surprising, but that is not going to help anyone in any place. So caffeine, moderation. Alcohol, I would be even more moderate. And then also very moderate or as minimalistic as you can with ultra-processed food. And there's also a few lifestyle interventions, and these have a commonality of swinging you parasympathetic. Slow, deep, or belly breathing. There was a clinical trial from 2021 that found slow belly breathing for 30 minutes per day, done only twice per week, improved blood pressure and also HRV, heart rate variability. And there's other similar data for things like singing, humming, and chanting. All of these directly stimulate the vagus nerve. Additionally, meditation and hypnosis have also found benefit for increasing the tone of the vagus nerve. There's a few others like exercise, yoga, and cold exposure, all of which we want to load appropriately. Too little, you won't have any benefit, but too much can be overly stimulating because all of these, exercise, yoga, and cold plunge, if they're done excessively, may swing you too sympathetic. Yoga is a bit more in the gray for some obvious reasons. If it's a very gentle flow yoga like vinyasana, then less likely to be overstimulating. However, if it's a 90-minute heated Bikram class and you're doing that 7 days a week, that might be too much stimulation. And the theme with these is they'll push you a bit or a lot sympathetic, and then the recovery is where you get the parasympathetic. So if you feel you're kind of burnt out, if you're tired, you're not sleeping well, that's where gentler exercise, yoga, and more moderate or tempered use of cold plunge is probably the right way to apply these. Okay, as we transition to some of the other supports, I wanted to share Jasmine's story. She is our wonderful office manager. She's the best. Sadly, she was having low blood pressure, dizziness when standing, very, very poor sleep, and anxiety. Now, her conventional doctor recommended an antidepressant and a beta blocker, which with no other option on the table, okay, but Jasmine did not like the way she felt on these, and I would agree that they are really masking or treating the symptoms but not addressing the cause. When listening to what was going on with Jasmine, it seemed fairly clear that she was burnt out and there was lack of vagal tone or lack of that parasympathetic activation of her nervous system. Two things were recommended to her: a vagal nerve stimulating device and electrolytes. And here is Dr. Scott from the clinic. He was working with Jasmine and he has a few more details.
Within about 2 weeks of Jasmine starting the vagus nerve stimulating device and the electrolytes, she reported she saw a dramatic improvement in her insomnia, where she was now sleeping 6 to 7 hours per night, which was a big increase from her previous maybe 3 hours or so per night. Her heart palpitations have also improved significantly, as well as her anxiety, to the point where now she is no longer on the anxiety antidepressant medication, and she's actually in the process of weaning off of her beta blocker because her heart rhythm is just that much more stabilized and she no longer needs the medication. And I want to quote Jasmine. She had let us know, "These treatments have been a game changer. I'm beyond grateful for these recommendations, and I'm starting to feel like myself again."
So amazing, Jasmine. I'm so glad you're feeling better. And I would call this a home run, or if not a home run, at least a good base hit, clearly moving us in the right direction. So this brings us to the second technique, which is the use of a vagal nerve stimulating device. So there are two ways this can be applied: carotid or over the neck, or alternatively in the ear, what's known as auricular. My recommendation would be using an auricular or ear, essentially a headphone application device. What we've been recommending at the clinic, what Jasmine has used, is a product known as the VaguStim. Simple headphone. It's easy to use. As you can see from this photo here, it is inexpensive. And I favor this over other options, which are mainly the carotid or over the neck. I find the research regarding the auricular more compelling. There's a broader swath of conditions that have been studied. And also, this is just more so my bias, but if we're trying to retrain your nervous system and some of these key regulatory centers in the brain, like the amygdala and the hippocampus, I just don't think you're going to have a retraining effect in a short treatment duration as you see with the neck application, which is usually about 2 minutes per treatment. The trend you see in a lot of therapies for the nervous system is you want to have a lower amplitude of stimulus over a longer period of time. That's just sort of my interpretation. I can't say there's been a comparative, to my knowledge, there has not been a comparative study. But all that to say, my recommendation would be the headphone or auricular application. Easy, not expensive, and I think it'll probably have a better impact on attuning the nervous system in that direction of being parasympathetic that we're trying to target. Now, let's discuss some of the very exciting research regarding how devices like the VaguStim can help balance the brain and shift you more parasympathetic. These vagal nerve stimulating devices have been shown to increase the function of the vagus nerve, which through their cholinergic pathways are strongly anti-inflammatory. See, the vagus nerve, in part, will release acetylcholine. And acetylcholine can be strongly anti-inflammatory. It will inhibit mast cells. So mast cells are part of what underlies the allergic response and leads to high levels of histamine. Acetylcholine in the vagus nerve also inhibits macrophages, which release a number of inflammatory cytokines, kind of like that slide we showed earlier with the stressed versus non-stressed people having higher levels of inflammatory cytokines in response to stimulation with LPS. Additionally, the vagus nerve and the resultant acetylcholine will modulate T helper cells and dendritic cells. Coming back to the food allergy analogy, let's say dairy, part of what might be causing a response, a negative response or reaction to certain foods is if your T cells are tagging foods inappropriately, telling your antibodies to attack that food. So by modulating the T helper cells, we can decrease the amount of targeting of food and environment particles that can lead to an incorrect inflammatory response. And the dendritic cells work very similarly in the sense that they present antigens to the immune system. And if you do so, again, taking dairy as one example of many, incorrectly, now you start reacting to foods or environmental triggers or supplements that you shouldn't, because the way that the T cells tag or the dendritic cells present is not functioning correctly. The immune system is overzealous. You are too inflammatory, too reactive. But like I always say, show me the outcome data. So there's been a number of studies here. One I found very compelling. A meta-analysis found decreased inflammation as C-reactive protein, interleukin 10, and IFN gamma, so all inflammatory cytokines, decreased stool calprotectin in inflammatory bowel disease patients, and improved rheumatoid arthritis severity. Now, if you're saying to yourself, hang on a second, I thought that acetylcholine was used for memory, for stimulation. We've talked about how nicotine, caffeine, even this club moss called huperzine A, all increase acetylcholine and help with cognition and function. It depends where the acetylcholine is being released. If the acetylcholine is being released on the sympathetic side, then it's very stimulating and it's not anti-inflammatory. It has merit, but we need that balance. So when we have better function of the parasympathetic nervous system, the rest, digest, recover, and we have the acetylcholine released there, that's when it functions as a very powerful anti-inflammatory. So just to clarify, acetylcholine functions throughout the entire nervous system. Depending on what side of the pendulum it's released, it will either be potentially pro-inflammatory if excessive, and if we don't have enough counterbalancing on the anti-inflammatory parasympathetic side, you can have a net inflammatory outcome. So one of the things that underlies autoimmunity is inflammation. So it's probably not surprising to see a clinical trial documenting reduced inflammation and autoimmunity by using these vagal nerve stimulating devices. This study I thought was remarkable. They used this non-invasive in-ear application like we covered a moment ago. What was so beneficial about this setup, it was double-blind sham, meaning someone got a headphone that didn't do anything. They thought it was, but it wasn't, versus intervention. Now, they found improvements in this orthostatic tachycardia, meaning you get up, your blood pressure cannot accommodate, you get dizzy, your heart races, you feel anxious. So that improved. Primary endpoint. Secondary endpoints also improved. Decrease anti-adrenergic antibodies. That is one of the autoimmunities that underlies this POTS syndrome. Decrease inflammatory cytokines and improvement in cardiac autonomic tone, or HRV. And what you see here is baseline scores between sham and active are similar. And then you see the active control group has a drop, which you want in heart rate. They have an improvement in the heart rate, so they no longer have this racing heart, which is part of this POTS syndrome, by a simple intervention of wearing these headphones for essentially 20 minutes twice per day, in this case for 2 months. Now, we've also talked about how the brain has this chain parasympathetically, and it also includes your gut. So if we have adequate vagal nerve function, we can improve things like constipation, diarrhea, and reflux. In fact, trials have documented benefit for reflux, for constipation, by improving motility with the use of these vagal nerve stimulating devices. If someone has increased pain, one of the things that these devices have also shown the ability to do is decrease pain. This could be pain as abdominal pain in IBS or muscle pain in fibromyalgia. Again, we have outcome data for both of these with vagal nerve stimulating devices. And because the vagal nerve occurs inside of that parasympathetic chain, when you stimulate the vagal nerve, you actually have impacts on the brain, the amygdala and the hippocampus, like we talked about earlier. So this has been documented, but also correspondingly, it's been documented that vagal nerve stimulation devices will improve serotonin, GABA, and norepinephrine. And probably the most important outcome finding here is improved depression and anxiety. Other benefits that have been documented include, but are not limited to, improved fatigue, improved insomnia, which is huge. If someone is not sleeping well solving that one problem can resolve so many other secondary problems just by that one win. Improve blood pressure and improve sexual arousal in women. The only contraindication with these devices are arrhythmias, pacemaker or other implanted devices, and pregnancy. So if you have any of these, it doesn't mean you can't use a device, but you just want to check in with a healthcare provider first. Okay, the third way to stimulate the vagus nerve in this sort of parasympathetic chain is with nutritional supplementation. Some obvious things here: reduce processed food, increase whole, fresh foods, and nutrient-dense foods. It can be more nuanced if we're talking about interventions that will improve someone's gut health, but a high-level blanket recommendation would be as such, with a few other caveats. One here that I think is very important for you to know about is salt intake. Case in point, clinical trial with 36 healthy women. They were put on a 1-week low sodium diet. It was not good for them. Their HRVs dropped. Remember, you want high HRV, so you have high swing of that pendulum. Their HRVs were normalized or restored at 3,500 milligrams of salt per day. As context, Americans average about 3,400 milligrams of sodium per day, but dietary guidelines, which I do not agree with and I feel are very antiquated, recommend to limit sodium to less than 2,300 milligrams per day. The short backstory there is many nutrients and foodstuffs have been lumped in with processed food and therefore recommended to avoid or pull out of the diet. This is something we'll be doing a follow-up video on, but low sodium diets, I think, are the wrong move for probably the majority of people. And as Jasmine's case and also this clinical trial substantiates, getting to a normal level of salt is important. And again, some of the backstory here is public health officials are trying to give dietary recommendations for a population that are eating way too much processed food. So in that context, maybe it kind of works, but there's a few things here that we want to disentangle. And we have seen so many times in the clinic that increasing salt intake for people who are stressed, who don't sleep well, who have anxiousness, who have low blood pressure, improves their performance. And actually, Dr. Mike T. Nelson, who is a HRV researcher, has commented to me that his HRV improved nicely when he added 1 or 2 packs of the LMNT electrolyte to his routine per day. So sodium is an important one. Another is omega-3s. A 2013 meta-analysis of 15 clinical trials found that omega-3 supplementation improved HRV, again, improved the swing in that pendulum. They needed to see participants hit over 1,500 milligrams per day of a formula combining EPA and DHA. The ratios of the two doesn't seem to matter. It's just hitting that threshold of at least 1,500 milligrams per day. Magnesium. A 2016 study found that 400 milligrams per day of magnesium, again, improved HRV. Now, they used a form that was magnesium oxide combined with aspartate, HCl. My view, even though I don't think there's adequate data to support this yet, is that the other forms that are known to have better bioavailability, like glycinate or threonate, will probably be best for modulating the nervous system due to their absorption. As context, if you're trying to help someone move their bowels, you actually want to favor the forms that are less absorbed, so they pull more water into the bowel and help people with constipation and with regularity. So oxide or citrate might be better in these populations. But if we're trying to get the best absorption, gut and then into the brain, again, I think glycinate or threonate are probably better bets. And then a final couple to consider, this is not an exhaustive list, would be a good clinical dose multivitamin. The following have been shown to improve HRV: vitamin D, vitamin B12, vitamin C and E, antioxidants, zinc. Speaking of antioxidants, CoQ10 and separately acetyl L-carnitine have both been shown to improve either HRV or dysautonomia, another way of measuring dysfunction in the nervous system. And then a touch more speculatively, some anti-stress either nutrients or herbs like L-theanine, rhodiola, ashwagandha, and ginseng I think are worth considering including into a plan to help support that pendulum. So the fourth and final component of this would be a probiotic, because the gut-brain axis is a significant component to brain health. And it's great to see how the importance of gut health for brain health is kind of becoming more popular in common culture. But here's one study that I think is fascinating that substantiates the connection between the two. This study was published by Dr. Imam Quigley, who is at Houston Methodist. And what he found was in individuals who did not have normal cortisol release, so this is baseline low daytime cortisol, the use of a probiotic normalized the production of their cortisol, reduced their IBS symptoms, and remember how we discussed that low daytime cortisol usually occurs with high nighttime cortisol and therefore poor sleep? Well, what do you know? People also saw improvements in their sleep. This lasted for the 2 months that they were on the probiotics. However, when they stopped, they started to regress and return back to baseline, highlighting a key concept that in some people, 2 months of probiotic supplementation may be insufficient to fully rebalance the gut and reduce some of these inflammatory pathways from the gut to the brain and from the brain back down to the periphery. So I would recommend a minimum of 2 months, probably more like 3. Try to come off the probiotic, and if you regress, go back on for another 2 to 3 months. Now, probiotics have also been shown to improve HRV and to lower resting heart rate. The protocol that we recommend is using the triple therapy formula. And this is because, sort of similar to the nutrients, it would make sense that if you combined, let's say, vitamin D along with the zinc and vitamin E, you would have better results than if you just used, let's say, vitamin C. So stringing together multiple interventions has a better aggregate effect. So what we've been developing here in this evidence-based meta protocol is, if we zoom out, you see that pretty much every probiotic on the market can be loosely categorized as either a blend of lactobacillus and bifidobacterium species, or a healthy fungus, either Saccharomyces boulardii or Saccharomyces cerevisiae, or bacillus species, also sometimes known as soil-based. And if we take all three together, at least our observation has been you have a better efficacy than just one formula alone. So we recommend using the triple therapy rather than buying 3 different bottles and worrying about taking 2 of the one and 1 of the other one and 3 of the third. You take 1 packet 1 to 2 times per day, and that gives you a very strong clinical dose probiotic. And remember, 2 to 3 months and then reevaluate. You may need, given the results of the Quigley study, longer. I also wanted to take one step back. Another very compelling data point with probiotics came from Dr. Alex Ford, who's been on the podcast in the past. And he found that the activation of the amygdala in the brain was actually normalized by probiotics. How did they know that? Fascinating study. They put people in functional MRIs. One group was not using probiotics. The other group was. While in the functional MRI and having their brains scanned, the individuals looked at the settling images and they looked for how much blood flow and activation of the amygdala either increased or did not increase. And what they found was a very heightened stress response in those not taking probiotics and a much more attenuated or normalized stress response in those using the probiotics. Now remember that the amygdala is the first step of that chain we talked about earlier. Amygdala to the hypothalamus. Hypothalamus tells the adrenals to make hormone, right? So this is how the findings from Ford in the brain, the amygdala, connect to what Quigley found, which was you correct amygdala activation, you normalize the stimulus from the hypothalamus to make cortisol, therefore normalize cortisol levels, therefore normalize sleep. So this is why I think a probiotic is a very important inclusion if you want to correct the gut, brain, and sort of brain endocrine loop that is so crucially important. Okay, those are the 4 components to help fix your pendulum. Now, if you get stuck, then there could be an overlooked source of inflammation, because remember, inflammation will trigger the sympathetic nervous system, and it may be one of the underlying factors that gets you stuck in that sympathetic fight or flight position. Everything we talked about, is anti-inflammatory. However, if someone has a stubborn bacterial or fungal overgrowth in the gut, some type of chronic infection, it is possible that you will only see partial response. So again, if you do get stuck, feel free to reach out to the clinic. This is what we love to do. Dig in, like with Jasmine's case, listen to her story and try to figure out where is the lack of responsiveness coming from, and then targeting our interventions toward that factor or factors. Okay, well, there you have it. There is a significant opportunity to improve your health by modulating that pendulum and fixing the parasympathetic side of your nervous system. I'll leave you with this quote. Stress is like the tension on a violin string. You need enough tension so you can make music, but not so much that it snaps. So keep this in mind. You have a number of interventions to de-stress and also reduce inflammation in your system. Let me know how it goes in the comments. This is Dr. Risho. I'll talk to you next time.